So each of us today has a job here to do, right? My job is to talk and yours is to listen. The challenge is for me to finish my job before you have finished yours. I was just being funny. Commissioner Darnell, thank you for being here. Commissioner Darnell, they say it takes only one to start a movement and create a positive change. In 2012, you sponsored a resolution directing the county manager and the health services department to develop an asthma coalition control plan, action plan to address asthma-related disparities in Fulton County. Can you give us a little bit more detail of why you chose to do it?
Thank you very much, and let me just say that we do appreciate so very, very much the dedication and the energy and the commitment of our staff and all of the representatives of our important community institutions who are here today to help us deal with health disparities and help us to deal with all of the conditions which we have been advised by as the basis of this problem. 3 years ago, we were advised by our staff that the community's concern regarding the incidence of respiratory disease in certain sections of District 5 in Fulton County, which included Northwest Atlanta and Southwest Atlanta, that the incidence of asthma, emergency visits of children to hospitals, and other metrics were higher in that district than in any other area of Fulton County. And because it is my belief that public policy should be based upon evidence and data, we asked the Department of Health Services to do an assessment, a health assessment of that entire area. Of course, folks were already planning the design of the building, but we thought it might be helpful to try to understand the problem first. And the health assessment, the data collected by the Department of Health Services, confirmed and convinced the Board of Commissioners that there was a target population within Fulton County that had a disproportionate incidence of asthma and other respiratory diseases. Working with the community, we developed recommendations to the board that in addition to the usual excellent public health initiatives in the area of prevention and education, that we would focus on asthma because of the devastating effect, disproportionate effect that it was having upon children in an area that covered over 200,000 people.
Thank you so much for that response. And you can see where we have, because we had the political will to make this happen, we were able to build the coalition and educate and use with limited resources, we were able to move forward.
Absolutely. I would emphasize the word coalition.
Okay.
Government, community, and professionals.
Great. Sarah Passons. Sarah, you looked at the press release right after Commissioner Darnell passed the resolution, and he called my office, and he introduced Brennan to us. Since then, she's become our poster child for the Asthma Coalition. Many of us here don't know who Brennan is. Can you tell us who she is, and if she was here, what would she want to tell us?
And both my children were active, healthy, fun-loving children. And Brennan was especially kind to people and interested in learning about other people. She enjoyed the arts, and she enjoyed music, and she enjoyed her school and her classmates. And she was just a normal, fun-loving kid. And Brennan, unfortunately, passed away very unexpectedly from an adverse reaction to a medication that she was on as a preventative medication for asthma. And that has obviously turned our lives upside down and been an eye-opener of a sort no parent wants to go through. Nobody wants to rush their child to an emergency room the first time because of asthma and not come home without that child. And nobody wants to be the mother of the poster child. Nobody wants to walk through their home and look at a picture hanging on the wall and say, this is what's left now, my memories and my pictures. And I think if Brennan had survived that night, I think Brennan would be fantastic at sitting up here talking about the night she almost died. I personally hate public speaking, sorry. I'm not good at this. I get too emotional, and it's just too raw still. It's only been a little over 2.5 years. But I think Brennan would love to stand up for children her own age and all children and talk about her experiences of asthma from the beginning until the night she almost died. I think she would like to educate a lot of people that cared for her, a lot of parents who are caring for their children just like I was and my husband was. We thought we had everything under control. We went to our doctor visits, we refilled our medications. We were referred by one doctor to another doctor, the top doctors in our area in the northern suburbs of Fulton County. So we thought we were doing everything right. And we learned a lot since that night. There's a lot more to be learned about asthma and about the seriousness of the disparities. A lot of us let our guards down in beliefs that as long as we have a rescue inhaler with us, we'll be okay, or we'll make it to the hospital on time. So our focus has been to educate parents on the 911s of the action plans, what to do when you get to that point that you're calling 911 or you're carrying your child to your car and driving as fast as you can to the closest emergency room, even if it's only 5 miles away. You might not make it. There might be more you could do. I suffer with that on a daily basis. What else could I have done? How could I have been better prepared? How could I have known what to expect, what to look for if this was more than just tightness of the chest and wheezing and her rescue medications weren't working. So for us, that was huge. In the over 5 years that she was on one particular medication under one specialist care, there was never any discussion of if that inhaler doesn't work, what to do while you're waiting for an ambulance, or if you're driving to the hospital, what to do before you leave that house. So that's been our main focus, is to try to push that asthma action plan a little further and open everyone's minds to the 911 zone.
Thank you so much for your insight on this and for sharing, Sarah. We're here to support you. Thank you.